the title of our next presentation is COVID-19 Vaccinations and School Community Resources, Children's Longitudinal Health and Education Outcomes, using linked
If we're sharing.
administrative data. This presentation is Amy Schwartz from the University of Delaware.
Thank you.
Now you got a clicker there for me.
I'm going to click up here. So this is a presentation that's entirely too long. And so I'm going to be skipping by some things. And then on top of it, I have a zillion appendix slides at the end, which I think are still there, anticipating some of your questions. So thank you in advance for your patience. This is very much a group project here, crossing several universities and organizations. And we really, all of us, appreciate the funding we've received from this program. What's really important about the program, about the project, is that it represents a collaboration between folks at the Department of Health and Mental Hygiene in New York City, Kevin Conti, and Sophia Day. Some folks in the medical school at NYU, Brian Elbel, David Lee, and Lorna Thorpe. And some folks in the policy world. We all used to be at NYU a long time ago, but now we're at Delaware and Syracuse and at NYU. But what's really important about this is that it allows us to look at this, the nexus of schools, education, and health. And it's with some pretty unique data. So I'm going to talk some about the data and some of the things we've done, and then try, if I have enough time, to talk about a particular piece we're looking at. So our aims were three. The first one is with a focus on disparities, to look at the health and education changes among children in the years after COVID, using this new comprehensive, powerful set of linked child-level administrative data, which I think we've made some really good progress on. Try to see what was the impact of vaccination rates using that data. And then to look at the role of neighborhood and school resources in exacerbating or mitigating these health and educational disparities. So we've made some real progress on all of those. Obviously, it's all going to come together in the last year of the project. But let me tell you first about what we call SBEE. This New York City Student Population Health Registry is what has been the heavy lifting to make this work. We have multiple health and education-oriented municipal data sources that are linked at the child level. It's this joint project of the Department of Health and Mental Hygiene and the Department of Education, which allows you to link up these data sets, because if you don't get this joint project, the health line is behind HIPAA, and the school line is behind FERPA. And so to solve this, we created this unit that sits at the nexus. It sits in between them, is a creature of both. And this is something I think is an important thing to know that was really only possible because of COVID. So something that we had been working for years to do, couldn't somehow get anybody, we'd get close and someone wouldn't sign off on it. And then COVID came. And suddenly it felt like we really have to figure this out. And so, this sat on a bunch of years of progress. And so but I think it's pretty exciting. It includes all the kids in New York City, longitudinal. This work focuses on kids in public schools, because not all the kids in New York City go to public schools. Some of them are too young. Some of them go to parochial schools and other private schools. But it tends to be about 1 million kids a year. A little bit less now because there's been exit from the city, but that's common across major cities across the country. About 2/3 of the kids are Black or Hispanic, but over time what has really changed is that that's really primarily Hispanic. So it's about 20-something Black, close to 40 Hispanic, depending on which year and how you slice it, and less than 20, a little bit white and Asian. So Hispanics are the big group. It'll motivate some of the other things that decisions we make in modeling. And about 3/4 of them are low income, measured as eligible for free reduced price lunch, mostly through their participation in other programs. So if you're hearing this, there's all this linking going on, right, that generates a lot of things, and that's a true story. So from just some examples, we get demographics in this core registry. It's name, gender, race, ethnicity, where you live turns out to be extremely helpful in linking the school they attend. These will come on many things. We can then access the citywide immunization registry, and we do. So we know, where and when and what kids got on immunizations, Medicaid claims, emergency room visits through Sparks, through the Department of Education, their daily attendance, their graduation records, their test scores. They do the fitness gram, so we know kids, height and weight, their test scores and blah, blah, all that stuff. And then we have a bunch of areas about the schools. Do they have a nurse? How big is it? Where is it? What grade do they serve? And so on. Okay, so I think I'm not going to talk all about the details on the different papers that we've done, but we've done some work on mental health, and I think we talked about that 2 years ago at this meeting. We've looked at impacts on well child visits and routine vaccinations, and are now looking at chronic absenteeism, which really rose during the pandemic. We've also tried to understand who gets vaccinated and what is it that explains those differences in vaccination rates. We see, pretty interesting differences in vaccination rates that vary across gender, age, English proficiency, and race. Sorry. And then in our most recent work, what we've been trying to do is look at the impacts of peer vaccination rates on own vaccination rates. And you may have seen this paper. I don't think I talked about it last year, but I think at some conferences we've talked some about it. And what's interesting there is that you can leverage the variation in the age distribution of your classmates. That generates differences in peer vaccination rates. And we find some meaningful effects. Okay. In the most recent things, we're trying to drill down and understand the school responses and to the COVID pandemic and the impact of that. And one of those is looking at the hold harmless policy, which many school districts had, which is when schools closed, it's some version, or schools or kids left, they didn't cut the school budgets so that the schools had to fire teachers, and the federal government helped. So what you had in New York is there was a bunch of schools, many, lost students. Enrollment was unexpectedly low. And in previous years, they would have had money taken back. Sort of middle of the year, there would have been money taken back to adjust that, to even it up, so that it's according to formula, so that some schools didn't get more because of happenstance. But in the middle of the pandemic, just as they were supposed to start taking the money back, they said, we're not doing it this year. You could keep the money. And the next year, they did the same thing. So there were 2 years, 21 and 22. This hold harmless policy was announced kind of at the last hour. And then for 2023, they said they gave lots of notice about it. And then this paper is in progress, so you might have seen an early version. What's pretty interesting is that we saw good outcomes for teachers. These hold harmless policies were effective at keeping teachers from being fired. They maintained stability in the teaching workforce, reduced class sizes, because as it turned out, the schools that had lost kids now had smaller classes. We saw no impact on test scores, no impact on absenteeism. Absenteeism is a really good measure because it's measured all the way through the pandemic, and it's closely related to test scores. But in that third year, where they announced it in advance, we see positive effects on absenteeism. So where we are with that paper now is trying to kind of understand that a little bit better. But we think it's a story about how these surprise, you've got a little bit more money policies don't actually have the impact we want them to have. And this is certainly the sort of things that principals would complain about, but I think that we didn't have evidence on it. And we think, we do now. So that's our hold harmless paper. So we've got this series of papers that are, these are, I think I've mentioned most of, that are all in some state of undress, but will all be, you know, dressing at the party pretty soon. One of them we're working on now has been focusing on something that resonated for me in the, like 5 more minutes, right? Awesome. In some of these other conversations that we call it inequality and COVID risk at school. And here we are examining these racial disparities in what we want to call exposure to risky schools. Thank you. We're looking at indoor density, meaning square footage per pupil, vaccination rates, and the consequences for absenteeism. And so here the idea was that we have well documented in New York and elsewhere that there was widening absenteeism, racial disparities in absenteeism and chronic absenteeism in particular. Chronic absenteeism was up across the board, but particularly Black and Hispanic students and low-income students. And we know absenteeism matters. We also, you know, kept hearing from advocates, public health folks, we really need to be careful because it is likely, and we worry, that disadvantaged kids are going to go to schools that offer greater risk. The disadvantaged kids are going to be disadvantaged and return to school because they're going to go to worse schools. They're going to be schools that have like worse HVAC, they're crowded, no one's going to be vaccinated, and, you know, sort of various public policy reports or, you know, things in the news about how unfair it is, that advantaged families will be able to protect their children, disadvantaged kids are going to be worse off. And there's, you know, some evidence on racial disparities in environment, school environment from different places. So we, you know, like we pick up the shovel and we say, well, all right, we're going to figure this, we're going to try to figure this out and ask how large are these racial disparities in COVID risk at school? And to what extent do these disparities explain these growing gaps in chronic absenteeism and absenteeism? So put all this data together. In particular, we collect data on square footage in the schools. Yes, we have the school and we have the classroom square footage. Doesn't really change the results. And school vaccination rates, which we can get at, you know, all sorts of different detail. And we have all these socio-demographic characteristics. We know where the kids live. We have all sorts of control variables. And then we try to characterize schools as high and low risk. I know I don't have too much time, but in the end, we're trying to understand, are there racial disparities in this? Was this unfair? I just said that. Okay, so we have all these different measures about high risk and low risk, and I'll explain how we thought about this. So we have 2 ways of dividing them up. I could show you others, but I'm just going to show you 2. And if you want to comment on something in particular, I'd love to know what you think about these because we've struggled a little. One is looking above and below median, and the other is looking above and below what we call these expert recommended thresholds. Just trying to figure out how much space is enough. This is pretty straightforward, above and below the median. The green ones were low risk. They have high vaccination rates and lots of space per pupil. The red ones we thought of as high risk. They had not so much space, low and low vaccination rates among the kids. Then you had these 2 sort of off groups that are mixed. They have high vaccination rates, but not so much space, or they have a lot of space and low vaccination rates. And you could do the same sort of exercise using these thresholds instead that are based on what experts recommend. Say, like, how much space does the CDC think you need to give a kid enough room in a classroom? And how high does the vaccination rate have to be before you get to herd immunity? So we did the same thing again, as you'll see based on this. We actually don't have that many low risk schools. And we have, you know, a good number of high risk. Yeah, I'm going to need like another minute after that. Sorry. So, you know, we did just what you think we did. You know, here you see these differences in these disparities in chronic absenteeism, where, for example, it's as low as 26% among whites and 49% among Blacks. differences in the kinds of school they attend. And just to read a couple, what this tells you is, average Asian kid goes to a school in which 57.5% of their kids, their classmates, are vaccinated. For white kids, close, 51%. Black and Hispanic kids, considerably lower. So indeed, we see Black and Hispanic kids, especially Black kids, go to schools with lower vaccination rates. But interestingly, theme song here, more space, more space. Okay, I'm not going to go through this. We use this regression model, which I think is just what you already had in your mind. So I'm not going to go through the equation, and I'm seeing you nod. Thank you. And so here's kind of basic results. Sure enough, if you look at the space with no controls, you see just what we saw before. The reference group here is white. Asians, a little bit less space. Blacks have the most space per pupil. Controlling for it, not much, but controlling for other things doesn't change too much. The CD effects are broad community districts. What fraction of these students, what's the likelihood that you go to a school that has a lot of space? For Blacks, it's considerably more. Now, why is that? Is it because they're so rich, they go to great schools with lots of space? I think that's not the way to think about it. The truth is that in the city, Black kids tend to go to schools that are not as good. They're not as in high demand. And so schools that are not in high demand, have open space. But schools that are in high demand, they're oversubscribed, they have lotteries, people are like, pulling strings to get in. They're crowded. They're using every inch they can. And so what that ends up meaning is that disadvantaged kids end up in schools that have more space. Advantaged kids go to schools that are denser. We see, I think what we expected when we look at the, more than when we look at the vaccination rate things, but I don't want to go through all the numbers, but what's I think the punchline here is that it is still the case that when we look at attendance, both vaccination rates really make a difference. They play a meaningful mediating role in explaining disparities in attendance and chronic absenteeism, and space not so much. So that's where we are on this work. I have many more if you want to know, but I think what we're trying to get at here is that we're trying to create this more nuanced view about who faces COVID risk at school and why. Interesting, useful thing to ask, as I was talking about in this other panel, about, to what extent can you protect yourself against the risk? Are you responsive to the school environment? Can you go to a high density school and protect yourself? We think what's pretty important is that we move away from there's a high risk, it's a low risk, and start to think about the many dimensions. We're working to get some better data on HVAC. Turns out it's a little complicated. Certainly could look at building age, but that's sort of where we are. Thank you.